17 internal medicine doctor or surgeon common job interview questions and pro answers. Hi everyone, Njabulo here, and welcome to Career Stimuli, where we prepare you to rise, excel, and land the career of your dreams. If you're an aspiring internal medicine doctor getting ready for interviews, you're in the perfect place today. I'm taking you through 17 of the most common internal medicine doctor job interview questions, along with expert-level answers that will help you shine. Whether you're finishing residency, changing roles, or stepping into a new chapter of your medical career, this video is packed with powerful tips and proven strategies to help you stand out. At Career Stimuli, we believe preparation sparks confidence, and with the right tools and mindset, you can achieve anything you set your mind to. Before we dive in, don't forget to subscribe to Career Stimuli, like this video if you find it helpful, comment below if you have any questions, and share it with anyone who could use a boost before their big interview. And make sure you hit that notification bell so you never miss a new career-building video. Alright, let's jump in and get you fully prepared to ace your internal medicine interview. So, internal medicine surgeon job interview question number 1. Are you board certified in internal medicine? Analyzing a question. This question is a great way for the interviewer to assess your qualifications and experience. If you are not board certified, consider taking steps to become certified before applying for this role. Suggested example answer: yes, I am currently board certified in internal medicine. In fact, I have been practicing internal medicine for 5 years now. My certification allows me to provide patients with comprehensive care that includes diagnosing illnesses, prescribing medications, and performing procedures. It also gives me the ability to treat patients of all ages. Internal medicine surgeon job interview question number 2. What are some of the most common conditions you treat as an internal medicine doctor? Analyzing a question. This question can help the interviewer get a better idea of your experience and expertise. You can use this opportunity to list some of the most common conditions you treat, but also include any unique or challenging cases that you have treated in the past. Suggested example answer: some of the most common conditions I treat are colds and flus, diabetes, high blood pressure, and cholesterol issues. However, I've also had patients who were experiencing more complex symptoms like chest pain, shortness of breath, and dizziness. It's important for me to be able to recognize these symptoms and provide an accurate diagnosis as quickly as possible so I can begin treatment. Internal medicine surgeon job interview question number 3. How do you determine the best course of treatment for your patients? Analyzing a question. This question can help the interviewer understand how you make decisions in your role as an internal medicine doctor. Use examples from past experiences to explain how you analyze information and use critical thinking skills to solve problems. Suggested example answer: when I meet with a patient for the first time, I ask them about their medical history and current symptoms. Then, I perform a physical examination to assess their vital signs and overall health. After this initial assessment, I review my findings with the patient and discuss treatment options based on their individual needs. In my last position, I had a patient who was experiencing chest pain that was unrelated to his heart. After performing a thorough examination, I determined he was suffering from acid reflux disease. He followed my recommendations and felt better within 2 weeks. Internal medicine surgeon job interview question number 4. What is your process for communicating with other medical professionals about your patients? Analyzing a question. Internal medicine doctors often work with other medical professionals, such as nurses and pharmacists. These professionals may need to know information about a patient's care or treatment plan. The interviewer wants to make sure you can communicate effectively with these colleagues. In your answer, explain how you ensure that all relevant parties have the same information about a patient's health status. Suggested example answer: I always try to meet with my patients before I leave for the day so I can discuss their progress and any changes in their condition. If there are any issues that require immediate attention, I will call another professional on staff to help me treat the patient. For example, if a patient needs an antibiotic prescription filled, I will ask a pharmacist to do it rather than prescribing it myself. Internal medicine surgeon job interview question number 5. Provide an example of a time when you had to be flexible in your approach to a patient's treatment. Analyzing a question. Internal medicine doctors often treat patients with complex medical histories. The interviewer wants to know how you will handle a situation where your initial diagnosis is incorrect and how you will communicate this information to the patient. Suggested example answer. I once had a patient who came in for treatment of high blood pressure. After running some tests, I discovered that his blood pressure was actually low. This led me to run more extensive tests to determine if there were any other health concerns. After further testing, we determined that he had an underactive thyroid gland. He needed medication for both conditions. In this case, flexibility was important because it allowed us to discover another issue that could have been overlooked otherwise. It also helped me develop my diagnostic skills by learning about different conditions that can cause similar symptoms. Internal medicine surgeon job interview question number 6. If a patient of yours was unhappy with the level of care you provided, how would you handle it? Analyzing a question. This question can help interviewers understand how you respond to challenges and learn from them. In your answer, try to explain what steps you would take to resolve the issue with the patient and improve your skills or processes in the future. Suggested example answer. If a patient was unhappy with my level of care, I would first listen to their concerns and apologize for any mistakes on my part. Then, I would schedule a follow-up appointment so we could discuss ways to improve their experience. After that, I would make sure to implement new strategies into my practice to prevent similar issues in the future. Internal medicine surgeon job interview question number 7. What would you do if you were working on a complex diagnosis and needed to consult an expert in the field? Analyzing a question. This question can help the interviewer assess your critical thinking skills and ability to collaborate with other medical professionals. Use examples from past experiences where you needed to seek out advice or assistance in diagnosing a patient's condition. Suggested example answer. If I was working on a complex diagnosis, I would first try to gather as much information about the patient's symptoms as possible. Then, if I still needed more information, I would reach out to my colleagues who specialize in that particular field of medicine. For example, when I worked at St. Mary's Hospital, I had a patient who came in complaining of severe stomach pain. After examining him, I determined he likely had appendicitis. However, because I didn't have any experience treating this condition, I asked one of our surgeons to come into the room and assist me. Internal medicine surgeon job interview question number 8. How well do you handle stress while working with patients? Analyzing a question. Internal medicine doctors often work long hours and have to manage a lot of stress. Employers ask this question to make sure you can handle the job's demands. In your answer, explain how you stay calm when working with patients. Share some strategies that help you reduce stress. Suggested example answer. I find that I am able to remain calm while working with patients because I enjoy helping people. When I feel stressed, I take a short break to collect my thoughts. I also try to keep my schedule organized so I know what tasks I need to complete each day. This helps me prioritize my work and focus on the most important things. Internal medicine surgeon job interview question number 9. Do you enjoy educating patients about their conditions and helping them to understand their treatment options? Analyzing a question. This question can help the interviewer determine if you are a good fit for internal medicine. Internal medicine doctors often have to educate their patients about their conditions and treatment options, so it's important that they enjoy this aspect of the job. Your answer should show that you value educating your patients and helping them feel comfortable with their care. Suggested example answer. I love being able to explain complex medical information in an easy-to-understand way. I find that many people don't understand what is going on with their health, so I take pride in my ability to break down complicated concepts into something more manageable. I also like being able to help patients make informed decisions about their healthcare. Internal medicine surgeon job interview question number 10. When a patient comes to you with a condition you've never seen before, how do you react? Analyzing a question. This question is a great way to assess your critical thinking skills and how you react in unfamiliar situations. Internal medicine doctors often treat patients with rare conditions, so it's important that they can think critically and solve problems when needed. Suggested example answer. When I encounter a patient with an unknown condition, I first try to gather as much information about the symptoms as possible. Then, I research similar cases online or through medical journals to see if there are any patterns or similarities between my patient and others who have experienced this same condition. If I still haven't found anything after researching, I will consult other internal medicine specialists for their opinion on the matter. Internal medicine surgeon job interview question number 11. We want to ensure our patients have access to the best possible care. How would you use technology to enhance patient care? Analyzing a question. Technology is an important part of healthcare, and internal medicine doctors need to be able to use technology effectively. An interviewer may ask this question to learn more about your experience with technology in the workplace. In your answer, try to describe how you would use technology to benefit patients. Suggested example answer. I believe that technology can help us provide better care for our patients. For example, I have used a patient portal to communicate with my patients outside of office hours. This allows me to address their concerns quickly and ensure they feel comfortable asking questions at any time. Technology also helps me keep track of my patients' medical histories and test results, which makes it easier to provide them with the best possible care. Internal medicine surgeon job interview question number 12. Describe your process for maintaining your knowledge of current medical practices and treatments. Analyzing a question. This question can help the interviewer determine how you stay up to date on medical advancements and treatments. It also shows them that you are committed to your career as a physician. Use examples of ways you've kept yourself informed about new developments in medicine, such as attending conferences or reading journals. Suggested example answer. I regularly attend seminars and lectures at my local hospital. I also subscribe to several online journals where I can read articles from other physicians who have published their findings. I find these resources helpful for learning more about current treatment methods and medications. Internal medicine surgeon job interview question number 13. What makes you an ideal candidate to be an internal medicine doctor? Analyzing a question. This question is an opportunity to show the interviewer that you have a passion for your career and are qualified for this role. Internal medicine doctors often work long hours, so it's important to be passionate about helping patients in need. In your answer, share what inspired you to become an internal medicine doctor and how your skills and experience make you a good fit for this position. Suggested example answer. I became interested in becoming an internal medicine doctor because I wanted to help people who were suffering from chronic illnesses. My background as a nurse has given me valuable insight into how to treat patients with complex medical conditions. I am also committed to continuing my education and training to stay up to date on new treatments and technologies. Internal medicine surgeon job interview question number 14. Which aspects of medicine do you enjoy the most? Analyzing a question. This question can help the interviewer get to know you as a person and how your personality fits with their hospital or clinic. It also helps them understand what kind of work environment would be best for you. When answering this question, it can be helpful to mention specific tasks that you enjoy doing in medicine. Suggested example answer. I love getting to know my patients on a personal level. I find it rewarding when I am able to make a diagnosis based on more than just symptoms. For example, if I see a patient who has been experiencing headaches and nausea, but they are also having trouble sleeping at night. After talking with them about their life, I discover that they have recently lost their job and are worried about paying rent. This information helps me diagnose them with anxiety, which is treatable. Internal medicine surgeon job interview question number 15. What do you think is the most important aspect of patient care? Analyzing a question. This question can help the interviewer get to know you as a person and how your values align with those of their organization. It also helps them understand what you consider most important in your work, which can be helpful when they are deciding whether or not you would be a good fit for their team. When answering this question, it can be beneficial to mention something specific about the practice that resonates with you. Suggested example answer. I think the most important aspect of patient care is building relationships with my patients. I believe that by getting to know each individual on a personal level, I am better able to provide them with the best possible care. In my last role, I was able to create a system where I could spend 5 minutes with every new patient before their appointment so that we could get to know one another. Internal medicine surgeon job interview question number 16. How often do you see patients on average? Analyzing a question. This question can help the interviewer understand how you balance your workload and manage time. Your answer should show that you are able to handle a large patient load while still providing quality care. Suggested example answer: I usually see about 20 patients per day, but I am comfortable seeing up to 30 if needed. In my previous role, I was often assigned to work with other doctors who had more complex cases than me, so I would take on additional patients to allow them to focus on their most challenging cases. This helped us provide better care for our patients. Internal medicine surgeon job interview question number 17. There is a new treatment for a condition you commonly treat. How would you decide whether to adopt it for your patients? Analyzing a question. This question can help interviewers evaluate your critical thinking skills and how you apply them to your work. In your answer, try to explain the process you would use to make a decision about whether or not to adopt a new treatment for one of your patients. Suggested example answer: I would first consider if there is any evidence that supports this treatment's effectiveness. If so, I would then look at the risks versus benefits of using it in my practice. Finally, I would discuss the pros and cons with my colleagues and other medical professionals who treat similar patients. And there you have it, 17 of the most common internal medicine doctor interview questions, along with powerful answers to help you stand out from the competition. Remember, every great career move starts with preparation and confidence, and you're already one step ahead just by being here today. If you found this video helpful, please give it a like, subscribe to Career Stimuli for more career-boosting content, comment below with your thoughts or any questions you have, and share this video with someone you know who's preparing for their big interview. And don't forget to hit that notification bell so you never miss our latest tips, strategies, and inspiration to help you thrive in your career. Thanks for watching, and remember, at Career Stimuli, we're here to help you rise higher, go further, and achieve the success you deserve. Good luck with your interview. You've got this. Bye.